I guess we talk first about, well, introduce ourselves.
Mm-hmm.
So I'll introduce myself. My name is Vinny. My full professional name is Dr. Vincent Barbieri. Uh, I'm a clinical psychologist. I work at a group practice with my buddy Jacob here. And uh, let's see, what's the reason why we started this?
Great question. Yeah. Main reason we started this. Well, I think the main reason we started this is just because we are fascinated by ourselves in therapy. We make so many good comments, you know.
We're enamored with ourselves.
We are self-absorbed and
We're self-absorbed and other-absorbed with each other, which I think is a good combo.
Like we have to make something out of this together.
It's just too much magic that goes unnoticed, unobserved.
This Disney World, and our clients hog all the glory, and so now we get to share not only just the fun random jokes and stuff that we make, but we get to share our interventions that we provide our clients, and just also areas where there's controversy or random ideas that are fun in society.
Mm-hmm. Yeah, I mean, honestly, like we're joking, but I do think access to therapy kind of is it's not that easy to find a therapist, and it's even harder to find a good therapist. And oftentimes people are left kind of discouraged, or they try and their insurance isn't accepted. And so I feel like giving people a glimpse into what we do and the things that we tell our clients, and if 3 people find it helpful, that's 3 more that we can get access to than we otherwise would have, because as a therapist, our caseload is 20 to 25, which means there's a lot of people that we're not seeing that could find things useful that we're saying. So I think that's cool. But you haven't introduced yourself yet.
Yeah, I'm the tree background one. I don't. My name's Jacob. I full name Dr. Jacob Ambrose. I'm also been working with Vinny, as Vinny mentioned, and I've been working in private practice for about 2 years now. Been licensed for about a year, and just got a lot of experience working in colleges and with undergrad students. So I found a passion in working with adults that way, and I specialize doing cognitive behavioral and psychodynamic work. So just a few things, but you'll learn more about me as we talk more, and Vinny pesters me with questions and whatnot.
Psychodynamic, like Shannon.
Yeah.
our we have a shared supervisor named Dr. Shannon Franklin, and she was very, very good, and also very, very psychodynamic, which has, I think, influenced both of us.
Sure. Yeah. Shannon was, I think, my most hands-on supervisor that would just, cut through all the bull and just say, hey, let's talk about what's actually going on. And that was helpful for me when dealing with shame. I think for me, it was...
We're jumping right into topics.
Yeah, we're diving in by mistake. That's how we're going to do things.
Rocking and rolling.
We almost named this podcast By Mistake because we want all the good stuff to happen by mistake. I made that up. But
yeah, we'll cut that.
Yeah. You better not say it. We'll cut that.
I'm going to say that every 10 seconds.
I'm like, all right, we're done.
Cut that. We have a list of topics that we're going to try and get to, and we realized we compiled them kind of separately, but with a shared iPhone note, and we realized that shame was like every other topic. So I think we're going to talk about shame.
Yep. Every single one, it was just interconnected, and I was like, all right, well, these are all just one topic, basically.
Well, also, I feel like shame is one of the few things in therapy that is just completely false as an idea. Like this, I mean, you give your definition of shame that I like.
So when I think about shame, I like to reference it in how it's connected to guilt. So when you think about guilt, I like to think about a stain on a shirt. Like if you have guilt, you have enough resources to wipe that off. But with shame, you are the stain. You are the stain, and if you try to wipe that away, then you're wiping yourself away. And so shame is self-hate. It's when you start to become the problem itself.
So it's like the belief that at your core there's something that you're lacking.
Yeah, 100%.
Like if we got rid of the shame, we'd also get rid of you.
Exactly. Yeah. And I'll probably use 100 analogies here, but that's just my language. I also think about whenever I'm working with clients, I'll use this analogy to describe shame versus guilt. So just imagine 2 kids working on like Legos together, trying to build something, and you have one kid make a mistake and their friend says, hey, stop it, that's not quite right. And then guilt looks like, oh, thank you for correcting me. Yeah, sure. Or you get pissed a little bit and you say, okay, I'll fix that. Shame is more, you say, hey, stop that. And then your friend curls up in fetal position and just stops looking at the project completely. Shame doesn't leave you with enough resources to keep working. The action urge is to cover up, to fall in the fetal position.
Yeah, I think that makes a lot of sense. And it's kind of like you're interpreting something saying as to mean that you're lacking something at your fundamental core. Like, oh, you're fucking up not because you maybe don't understand or don't know the knowledge. You're fucking up because you are flawed inherently, and it's being manifested in this moment.
Yeah, 100% agree with that.
And I feel like shame is such a tricky one because people have a hard time identifying it, you know? Like it's an easy word to talk about, but what it actually feels like is such a different animal.
Yeah. It's so under the radar too. It's like you can be experiencing shame, deal with some of it, and then have more of it but not even realize it because you've just been swimming in it your whole life. And that's kind of been my experience as well, dealing with shame throughout my life. It's like slowly uncovering. And the more you uncover, the more you realize how much shame you carried your whole life, really.
Not to out both of us, but we both have talked about how we grew up kind of navigating social anxiety. And I feel like social anxiety is an interesting one because at least like when you look at the literature, shame is not something that pops up a lot when you study social anxiety. It's more like the core construct that's studied is fear of being negatively evaluated. But I feel like something that I've experienced both personally and witnessed professionally is that people with social anxiety tend to have this assessment of themselves that they're lacking in social skills. And it's not really often correlated with reality. Like there are people who are lacking in social skills. There's lots of disorders where social cognition deficits exist, like autism and schizophrenia. And but social anxiety, I feel like, is one of those where when you're in public, you're assessing yourself as lacking something. And that is the social anxiety, not the actual experience of you being in a room, which is probably, I mean, I don't know about you, but it's generally people find it undetectable.
Yeah. No, that's so spot on to what I explained to myself and to people that my clients. It's shame is so self-evaluative and it's not close to reality, and it's so performance-based, when in reality the issue isn't your performance, it's more your evaluation of your performance.
That's I totally agree.
It's just like, usually I'll even point out that it's the evaluation you give yourself after the shame experience. That's the hardest part to deal with. That's the part that you want to work on first, not your performance. Because let's say you fix your performance, then you become convinced in your psyche that, well, I'm only accepted or loved if I correct this perceived issue first. And if you do that, then now you have this avoidance of that behavior.
Yeah.
And so part of beating shame is, how do you accept both the positives, the perceived positives and the perceived negatives of yourself?
So tied to shame, self-worth is kind of like the topic that we're circling.
Yeah. We're moving around that.
Well, no, because I feel like shame and self-worth kind of go hand in hand. Like if you think that there's something that you're lacking, then and if you think that your value is tied to how much you give to others, right? Your self-worth is inherently going to be low because your self-worth is tied to what you're giving rather than what you just are. So for instance, like let's say our friendship is based on like, every time I see you, I give you like a fucking ice cream cone. And I start to think that, well, I think he's friends with me because every time I see him, I give him an ice cream cone. You're going to start to, I would start to, I think unconsciously get anxious if I didn't have an ice cream cone the next time. You know what I mean?
Wow, that's a perfect example, yeah. I would like ice cream. It's just that's actually how our relationship started. Vinny started just handing me ice cream.
You're like mid-session. I'm like...
No, that makes perfect sense. Self-worth, if you start to build that, it's like two separate spectrums. And so more self-worth, the more you feel accepted, and then in that same view, shame can increase at the same time.
Yeah, yeah. I mean, I feel like, yeah, one of the topics that I wanted to talk about was like how to increase self-worth, because I feel like there's a lot of there's a lot of positive affirmation stuff, which I'm not against. Like, I think positive affirmations have their place in self-worth. You know, like, I'm a good person, I'm a this, I'm a that. But at the same time, I feel like if that's your primary route of trying to increase your self-worth, it's probably not going to have the impact you're looking for.
Yeah, I agree, and I think there's a lot of good stuff you can do with affirmations. I love affirmations.
Mm-hmm.
I used to hate them.
Yeah, me too. But they do work. There's some efficacy in them.
Yeah, it's like CBT, and CBT basically is a science that says, you know, your thoughts deeply impact the way you feel, and that impacts the way you behave, and all bidirectionally. And so affirmations are one way of adding to the equation positive thoughts to shift your behaviors and the way you feel. And yet it's it's like, how do you work with that? I also still have but I want to hear more of your thoughts on affirmations or self-worth and how you navigate that.
I feel like they're bi-directional, but they're not equally powerful. You know, like, one direction might be more powerful than the other. So for instance, like, if you're telling yourself, like, I can do this, I can do this, I can do this, if it's like maybe like a paper you have to write, maybe it drives you toward the behavior of actually writing the paper, but it might also not. And I think sometimes the behavior, which would be to sit down and start writing the paper, would actually work more effectively in telling yourself that you can do this, right? Like, I think self-worth and valuing yourself is kind of tied to the behaviors of someone who has self-worth. So for instance, same thing with the ice cream cone. Like, if I think that I've put myself into a quagmire where now I have to bring you ice cream cones every time I see you, and that's making me feel shitty. To increase my self-worth, I'd have to do something that would make me feel anxious, which is try and hang out with you without giving anything.
Wow, yeah, it's a good intervention.
And there's anxiety with that because your self-worth is low, and there's a belief that you have that it's tied to how much I give to others. But the second you start behaving in a way where your self-worth is not tied to how much you give to others, you start to feel better about who you are.
Yeah. And so you would say that at that point, what you're doing is you're making your self-worth less based on performance and more based on what would you fill in that blank with?
More based on, like, how you evaluate yourself in relation to others, like mattering as much as other people.
Just because of who you are.
Yes. Like for instance, like, I feel like the best friendships are ones where you don't have to have a thing to do. You just, like, sit on a couch and do nothing, right? If you can get to that level with a romantic partner or friend or parent or whatever, that's a level of intimacy where you're more vulnerable because you're not doing anything for someone. You know, there is no performance. You are just completely existing. And to feel like you're even capable of doing that would imply you think existing is enough.
Wow. Got chills. That's good. I feel like I'm in church.
I'm like reading.
Ooh, that's good.
Oh, talk about that. Let's talk about our spiritual backgrounds.
That's right. Yeah, I love that transition. So, cut that. We'll cut that.
Cut that.
Let me make sure my body feels comfortable. This is me beating shame. I didn't want to tell podcasters that I want to shift my position to feel more comfortable.
I just act really comfortable, even though I'm not.
Yeah, we all do. This is beating shame. You sitting in your chair from home, you're probably uncomfortable the way you're seated, right? No, maybe not. All right, we'll cut that. All right.
We're gonna cut that.
Church background. Yeah, I grew up in Louisiana, part of the Bible Belt, so I'm pretty predictable, which I hate. And
wait, how so?
I hate whenever it's kind of like the feeling of, let's say I was a pastor or something like that, and I was just always talking about Jesus.
But you think you're predictable?
I think it's just the statistic, basically. Like, oh, you grew up in Louisiana, of course you're a Christian. Or,
I mean, you have to exist in a context. You know, like, you don't exist in a vacuum.
What do you mean by that?
Let's start this therapy session. This is what I really want to do. I want to.
That's right.
This
is my therapy.
No, but like if you're like, I'm born in New York, so I was raised Catholic, and it's just kind of and whether you stay in that position or you do something else with your spirituality is besides the point. It's like you have to start somewhere.
That's a good point. I mean, I guess you could say then that it's mostly ego. Because I would think it would be really cool if I grew up in like a atheist environment and then became a Christian. Yeah.
Interesting.
It just feels more like I just didn't do what everybody else around. But that's a barrier there too. It's like, why am I limiting myself to not do the things that are what people would expect of me?
Mm-hmm.
So I think that was just a helpful insight. Thank you.
Well, it's also like, not to like just go on tangents, but it's like also being just for the audience at home, all 6 of you, for our middle school teacher, not that we went to the same school. See, I do this in therapy where I go on too many tangents and qualify too many things. I forgot what I was talking about.
That's where the magic happens.
What the fuck were we talking about? I don't even remember.
Church, right?
Oh, yeah. I still don't remember what I was going to say, though.
You said... we started talking about church, and then I started talking. You said your whole vacuum thing.
Oh yeah. By the way, don't you do this in therapy too, where like someone loses track and you have to like find your way backwards? You're like, okay, you were talking about asparagus, and then you mentioned your mother, and I think that meant you were talking.
I've done that.
I do that all
several
the time.
Times. Yeah, I'm like, where are we?
Meanwhile, I look at my notes, and my notes are not really like as related to what we're talking about as one would think. Mm-hmm. Like someone will say, like, I was dealing with anxiety, and I'll write down like whatever pops up in my head, which is totally not related. And they're like, tell me what, like, I'm a stenographer, tell me what we were just talking about. I'm like, I have feed my dog written down.
That's funny. I'll do the exact same thing, and I'll be taking notes, and I'm just like, this is good stuff, and it's a little different than what they said. And then by the time we come back to it, I'm just like, I'm putting words in my client's mouth. I'm like, you said on this date that this, so you agree with this point. I don't really do that, but
That's funny. Yeah. But yeah, I mean, it's funny because you're so. This is what I want to talk about. See, this is how it goes. How it comes back. Yep. Yeah. Like I think. Because we work, as people know, in a predominantly kind of gay neighborhood in San Diego. Yep. We have if not a majority, a significant minority of gay clients, and yet we're 2 straight dudes. We were probably their second choices, to be honest. Yeah. But once they get us,
we're like, you struck gold.
Of course, it's always fucking gold. But that's the thing, like. We're kind of coming, especially with new clients, coming into it with our own fears of being pigeonholed as, the straight dude who doesn't understand this, or I grew up in Louisiana, therefore I'm Christian. But there's such a more, it's such a different experience, I think, when you're actually talking to them.
Yeah, 100%. I tend to want to stray away from even the idea of having me as a Christian on the outside.
Yeah.
Then I start to think, okay, they've pigeonholed me, just like you said, and without getting a chance to know where my framework actually, or where I'm coming from.
See, it's crazy too because I'm not Christian anymore. I grew up Catholic. I have a pretty good knowledge of the Bible, but I do like a lot of the teachings of, especially the New Testament. So I will throw New Testament shit to clients all the time, but it's under the context of me not being Christian, so it's kind of easier to talk about. It's just a story to me, like it's just a good message, as opposed to having some religion attached to it. Yeah. Whereas you, I imagine you're a little more apprehensive.
Very different, yeah, because it's tied to my identity. And for you, maybe it's an analogy, and for me, it feels like, well, this is what I stand for. This is I believe this happened, X, Y, and Z, and so it's But the interesting part is the client would never probably know unless that was disclosed.
Do you tell them?
If they ask.
You're going to find out now.
Tune in, clients. If you're tuning in now and you didn't know I was a Christian, there you go.
I mean, that's the thing, though. Like, that's why I was so surprised when you said what you said, because to me, you're just like a very rounded out person. It's not like you're very thoughtful. I feel like you're almost like attaching a lack of thoughtfulness to the
That's
label.
The fear. That's the fear, that I'm not thoughtful, that I haven't thought about things. I mean, even whenever I was getting... I was in a relationship with my current wife. she
I
had,
call my wife my current wife as well, or my first wife.
yeah, my first wife. Pigeonholing us.
Cut that.
Yeah, cut that crap.
By the way, cut that for. I stole that from this show. It's Always Sunny in Philadelphia. They have like a podcast and they say cut that a lot.
Okay, we're gonna steal it.
I steal everything.
That's all. I mean, what else could we do?
I stole Wes's line in therapy.
What does
once.
Wes say?
Wes's line was, "Therapists exist because some parents aren't ready to have kids."
Oh,
That's a good fucking line.
There you go. That's a good line when you talk about kids and stuff.
So yeah, you just gotta steal a bunch of shit.
That's right. Yeah, steal a bunch of stuff. And then we need to bridge back the tangent.
Yeah.
Where we go? Where'd you steal us? Where'd you take us, Vinny?
We're talking about
Church. I've never. I need to talk about my story. Yeah. Even though I'm being pigeonholed, so this is good exposure for me.
Mm-hmm.
So grew up in the South, and parents were Christian, so I just kind of followed their path, started going to church with them. And at some point when I was like 12 or 13, I started to think, well, why am I doing this? Why do I think that there's a God that can throw fire down from the sky? And I don't see that happen today. And then I started to study apologetics, which is basically the study of how you might defend one faith or another. And thankfully, I had a really open-minded youth leader named Will Collins. And he was someone who didn't yell at me and say, just believe. He just said, you have to sort that out, and here are some good resources that you can look into. All you can do is look at the evidence and take a leap. At the end of the day, faith is sort of taking a leap based on evidence. And I use that analogy when it comes to therapy as well.
Mm-hmm.
How do we know the ground won't shatter beneath us? Well, we have to take a leap, And it's unhealthy to not take leaps sometimes. And sometimes it's unhealthy to take too many leaps. And so it's where do you find that balance? And I found the balance as a Christian a lot later on in first understanding and then trusting without needing to understand as much. And there's a big story there, but that's just spark notes.
The faith word, I think, is such a good one because I think I was raised Catholic, Italian, American, Catholic, New York, blah, 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 Catholic high school, blah, blah, blah. But then I started reading more kind of atheist books like not Richard Dawkins actually, but Christopher Hitchens and Sam Harris and all that stuff. And eventually I kind of found my way backwards, and now I'm kind of more into like Zen and Taoism and something called Advaita, which is in English it's more like non-duality, but that doesn't matter. But the point I'm trying to make is the idea of faith started out as like a whatever word, and then it started to bother me because it felt like my connotation of faith was it's leaping without evidence. That's what it was. But now it's such a positive one that I kind of forget that most secular people probably have a negative connotation with it.
Yeah. Blind faith. But the assumption is faith is all that, maybe.
But that's the reality. Like I think that a leap with evidence is like a perfect description of faith. Because ultimately, right, both of us deep down really feel like we know what we're talking about, and they buy it, but there's still a faith there because there's such a delay with therapy progress. I mean, like part of why therapy is hard is that you don't get immediate results. Part of why we have a job is because our minds naturally are seeking immediate relief, right? Mm-hmm. Like naturally seeking immediate relief will always kind of lead you long term into a shitty life.
Oh yeah. Yep. You'll snowball and then start realizing that you actually need a long-term solution.
Exactly. So, like, for instance, if you're a teenager and you start to develop social anxiety, immediate relief is don't engage in social interactions. But then that snowballs, and all of a sudden, not only are you avoidant of social interactions, but you're also developing a complex that you're lacking in the social skills. Mm-hmm. When in reality, you're kind of like reverse engineering that belief based on your behavior. Yeah. Which kind of gets to my point of the self-worth thing.
Self-worth, full circle.
But that's what I'm trying to do. Just
you got to stop.
I actually memorized this whole speech. No,
you got to stop with this good stuff because then you're going to...
Like run out of shit?
You're going to run out and you're going to think, oh, man, I need to keep this up.
Okay, pick another topic and we'll just keep circling back and forth.
I almost wanted to toss in one that wasn't in there. Attachment.
Do that. I love attachment, yeah.
Attachment is so cool. I'm going to brag on my credentials here, but I did a presentation on attachment to other psychologists, and the reason I got into attachment was because it really ties into this whole faith idea of when do you take a leap and when do you trust in authority, and how can you trust an authority? How does that impact the way you live your life and think? And so I'll always talk about styles of attachment like this. There's secure attachment, where you have a generally positive view of yourself and a positive view of others in a relationship. There's anxious attachment, where you have a positive view of others and a negative view of self. So you almost latch on to other authorities or people to build your shame. I mean, to get rid of your shame or to build your identity, sense of control, or all that good stuff. And then there's avoidant attachment, which is positive view of self, negative view of others. How do I keep myself safe in this world that's full of threats? And I find my anchor of decision making in myself. And the way they studied this was, well, John Bowlby started the whole thing, but I really like the next person, which was Mary Ainsworth, who followed up with research on kids. And she studied how kids reacted to a very strange situation. And it was called the strange situation because of how strange it was. And so what they would do is they would have this experiment room, and they'd have a mom and their kid walk in, and they would have the kid sit down somewhere and play with a mom and a stranger. And so the experimenter would be looking behind a two-way mirror, and they would observe how this kid would react when the mom would leave without saying anything. And these kids were like 2 years old. So the kids are trying to figure out life. And so they would see how these kids responded when the mom would leave without saying anything, or when they would come back, and then they would leave again and come back. Overall, the differences between secure, anxious, and avoidant attachment were just stark differences. And it was really based on what experiences they had with their caregiver early on. And that really shifted the way they handled that strange situation.
So someone with anxious attachment, the parent leaves the room, parent returns. How does the anxiously attached kid respond?
Anxious kids, sometimes they have to stop the experiment because they got so dysregulated as soon as mom left the room.
Do they normally, when the parent comes back, do they normally kind of go, yay? Or are they more like, ooh?
They're clinging on hard to mom, but they're kind of like, ugh, they're angry. They're almost wanting to yank mom's ear and say, hey, what the hell? Why'd you leave me? And they're tossing blocks around. They're making mom prove to them that they're not going to leave again. They're making mom prove that they have to clean up after their departure.
I always found that interesting. I've always found that to be one of the most interesting findings from that study. Like, the kid isn't just relieved, It's also like, and because, with attachment, my dissertation was like a big part of this was on attachment.
Oh yeah, same.
Yeah, I mean we've just this double lives.
Same person.
Yeah.
A few moments later.
Okay, the attachment thing. What did I want to talk about?
Something about anxious kids you liked.
That they react in a way where where they're kind of like upset. Oh yeah. So in my research of attachment, it's like it all centers around this concept of felt security, and basically in early childhood, developing a sense of felt security is the first step in being able to effectively regulate your emotions. And so when the parent leaves, and I think like the background on this too is important, right? Like, so what determines if a kid is going to react with an anxious attachment, a secure attachment, or avoidant attachment is based on the parent's parenting. And so, and you correct me if I'm wrong, but a secure attachment essentially means that the parent, when the baby cries, the parent comes and soothes it with a reliable frequency and consistency. With anxious attachment, the parent may come and soothe the child, but it's inconsistent and hard to predict. And so the child has a difficult time creating a sense of predictability and understanding the patterns of the parent. And with the avoidantly attached child, the parenting style is often just kind of not really attending to the needs of the child. Fair?
Yeah, no, 100%.
Yeah.
And it's super interesting because there's those, if you can predict your mother's return with, stability, if you can predict your mother's return, departure, and when they're going to come, when you have that kind of stability, you know that your caretaker is sensitive to your needs,
Mm-hmm.
and also the mirror neurons of the parent when they come back in the room. Do they feel joy in a sense of wanting to be there? And so they found that those two qualities deeply impact attachment as well. And so usually that will directly relate to, how consistent and how predictable is my parent.
It's so funny. I this was because I was talking to a client about this, but I reread my dissertation, just part of it, the attachment part, weirdly, like 2 days ago,
Oh,
for the
wow.
first time in like 2 years.
Fate.
Yes, like there's a research article, I forget who the authors were, that basically said if a parent is preoccupied with their own internal state when they're trying to take care of the child, the child's sense of self is going to be more identified with the parent than themselves. So,
Wow.
so this is like part of what my dissertation was about. It was about like the mentalization, which is just like understanding what your thoughts are, understanding what other people's thoughts are, and when that gets disrupted, that's another story. But the part that I found interesting is like the kind of repetitive process of baby cries, parent soothes it. That's like the first form of emotion regulation because the baby expresses it needs care and that care gets regulated. And then the other component of it is the parent has to demonstrate marked affect of the child. So if the child's anxious, the parent has to exaggerate anxiety on their face so that the child gets a sense of, oh, I'm feeling anxious. But when the parent is not attentive to the child's needs and more kind of like maybe they're distressed or whatever,
Spotlight's on them,
and the child kind of looks at the parent and their sense of self becomes kind of fused with the parent. And so what this might look like when you grow up is, if you're an adult and maybe your partner is distressed, you're going to feel distressed too, and you're not going to regulate yourself until you regulate them.
Mm-hmm. Wow. Just ABC connected.
It's crazy.
You can track the dots, really, if you think about it that way.
And it's also weird. I know you know this, but like the research that attaches that connects like early attachment to long-term kind of adult interpersonal relationships.
Yeah.
It's like insanely clear.
It's so clear. I was going to ask you too. What do you think about that? The connection between childhood and adulthood and the cause and effects of that.
It's wild how psych research is so kind of gray. It's like psych research is so like who the fuck, unless you get really specific, like this very specific subpopulation of people, then you can kind of get more accurate with your depiction of them. But generally speaking, it's so gray that when you find research that's so clear, and attachment research is so clear.
So clear, yeah. So clear.
Yeah.
I like to think about from the cognitive processing literature on stuck points and how you treat PTSD and how that connects to, attachment. Because it helps create a clear step-by-step idea of, well, how does one person get from their starting point to where they are now? The stuck point is basically this old belief that's keeping you stuck in an old pattern. And so a lot of people who have gone to war, they've experienced an environment of danger, unpredictability. And if they had a therapy session right in the middle of the battlefield, they probably wouldn't have made it back home. And so they learned a very good rule, be on guard. But once they get back home into civilization, keeping that belief isn't very helpful. You close a dumpster, they hide underneath their bed. It's if they did that back in the day, that would have been good, but now it's not working. And so anyways, I generalize that to study of attachment, where you learn these rules in childhood and you generalize your reaction to, or your parents' reaction to you, all the way out to the rest of your relationships. And so,
which makes sense, right? Like our minds like to take shortcuts. Like our minds prefer efficiency. So if it's easier to just assume everyone is not to be trusted, that will be. And I also think like you were talking about beliefs, unless your beliefs are rooted in like a pursuit of truth, like for instance, if you're religious or spiritual, whatever, you're trying to find out the truth. But other than that, most beliefs are functional. Like they are born out of functionality. They're not born out of truth or reality.
Yeah, no, exactly. I love that you're talking about the pursuit, because it's like you could be pursuing bliss. You could be pursuing not to learn from your mistakes, or you could be pursuing not to learn from your assumptions. I like to think about a rat in a maze, and experimenters are working on it. And so if it goes straight and then turns right, it gets shocked by a metal floorboard or whatever. And that rat gets a stuck point and learns if I turn right, I'm going to get shocked. And the experimenters know that's not the case. It's not that you turned right. That's not why you got shocked. The reason you got shocked is because you stepped on a metal plate with shock units. But you take the rat out of that maze, and then it starts to navigate the world and never makes a right turn again.
I love that analogy too, because it's like the maze is the shock is in the past, and we are assuming that the shock is gonna be maintained in the present. So like, if you have a parent who you don't feel like had an impact on your attachment, and maybe you're anxiously attached, right?
Mm-hmm.
And now you're in a romantic relationship, and that's triggering that same fear of abandonment and blah 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 blah. Your memory is what's going to be triggered, but it's going to feel very present. And I think that's the problem, is it feels very present.
Oh yeah. I think it feels so present. It feels like reality.
Mm-hmm.
And that's sort of what I think people get from therapy a whole lot. So people watching that haven't done therapy, this is part of what you're figuring out. You're figuring out what are your underlying assumptions. And the key word there is underlying, because you don't even know they're happening.
People, what's crazy to me? I say this before all the time, like thoughts and beliefs, which are basically dictating the most important parts of your behavior, people always think that they're like this like little bubble in your head that you're like, oh yeah, there's that thought that you can't trust people with red hats. Oh shit, I didn't even mean it like that, like the MAGA hats. But you can't trust people that are left-handed. I'm trying to be benign.
Yeah.
You can't trust people that are left-handed. Fuck, I totally forgot what I was talking about. Too much.
Sounded good, though.
It did. I feel like I was really on a roll.
Yeah. No, you're killing it.
My clients have to, like, keep notes for me. They're like,
yeah. I feel the same way. I'm like, okay, well, good to see you. And then if they don't bring up the agenda, they're like, well, last week we talked about... I'm just like, thank you.
I feel like I'm very present, but it's like a double-edged sword of, like... Once it's over, I step out of the presence.
Yeah, no, you're following that thread so closely,
Uh-huh.
you might forget the overall thing. I do that all the time.
But I think it's necessary as a therapist to. I almost feel like my way of doing therapy is like just kind of being a passive listener, not passive in the sense of not listening, but just kind of allowing what they're saying to hit me, and then seeing kind of what pops up for me. And sometimes it doesn't mean anything, and other times it's so kind of like to the bone that it feels like a good approach,
Mm-hmm. Yeah. That present focus, notice of what's happening in you, because that's basically telling you a story of how other people react to them.
And not to like jump around, but like the whole idea of emotions, right? Like okay, just to bring it all back to shame too. I feel like a lot of shame is I shouldn't be feeling what I'm feeling.
Mm-hmm. Yeah.
And it's like part of, I think the biggest thing that I stress to all my clients is that you're an instrument. Like, you are an instrument picking up things. So your emotions are your primary way of like reading to you what's happening into your world. And so the second you start trying to negotiate with an emotion or argue with it, or I shouldn't be feeling sad, or I should be happier, that's shame, because you're implying that your natural experience is wrong.
Yeah, no, I got chills as you've been saying that, because that's just been, I can so relate to that, yeah. It's
I can relate to
shutting
that
down your
too.
gut. Yeah, wow.
But like that's something that it's such a hard thing to explain to someone, because it's such a foreign concept, I think, especially in like the Western world, the idea of your emotions are telling you something. Now they might not be telling you exactly what you think they're telling you. Like, oh, I'm sad that my friend got a promotion, therefore whatever. I'm a jealous person.
Mm-hmm.
It's the thoughts that are attached to it usually are kind of distorted. So I wouldn't trust. I say trust no thought and trust every emotion.
Wow, I love that saying. It's figuring out what's happening underneath and the thoughts you add to it. That's the part where people can get confused.
100%, because it's like they think that there's this, and this is going back to the beliefs, right? This is the thing that people are governed by but don't realize they're governed by, which is, oh, I can like choose my experience. Like, you're not choosing shit.
No, yeah. Your reptile mind's in charge.
Yeah, like when you, and I feel like, especially like even with like the concept of acceptance, like people have such a difficult time conceptualizing what acceptance means, because it's like, but why would I accept something bad? It's like, it's not like you're choosing to, like, it's not hard to accept something positive. Like an example is if someone gets a promotion. Is that what you were talking about? Like that's not, if someone gets a promotion and you're like sad and you're like, I'm supposed to be happy. It's like, why? Why do you think that you're choosing any of this?
I see what you mean.
If anything, it's interesting that you're not feeling what you thought you should feel. That should be an indicator for you to investigate. And you can't really investigate if you're being judgmental.
Yeah.
And if you're saying the word should, you're being judgmental.
Yeah.
I feel like therapists, like our Voldemort is the word should.
Yeah. I had a supervisor say, if you say the word should here, you're shoulding all over yourself.
Yeah, I've heard that too.
We've all heard that one.
But I think that ties to the shame of like you're at your core, your instrument's broken, and that's why you're being given messages that are wrong. It's like they're not fucking wrong.
Yeah, and I think that's part of the reason why lying is the ultimate sin.
Mm-hmm.
I think there's a lot, and I'm stepping away from licensed psychologist saying this here, but that's what my gut tells me. And
I totally agree.
It just, you disconnect from reality, and when you disconnect from reality, you tell yourself, I am feeling this, but I shouldn't feel it.
Mm-hmm.
At that point, you deny what's actually happening inside of you, and then you disconnect with actually ever being able to make progress with yourself, because you're not talking to yourself anymore. You're talking to what you project ought to be.
Mm-hmm.
And then the world around you stops being able to interact with you, because now you're projecting something that's not real, and then the world around you starts to do things you don't like sometimes, and then you don't know why. And it's because you keep running into walls that exist, but it's because you haven't addressed the reality of what's actually happening inside of yourself.
Mm-hmm. Totally. I think I like to frame this with clients as like there's your actual self, which for a lot of people who have identity issues is a question mark. There's your perceived self, which if you have low self-worth, it would be below your actual self. And then there's your idealized self, which would be the should self. I should be feeling this. When my friend gets a promotion, I should be feeling happy for them. It'd be funny if you just got a promotion. It's clearly I'm talking about you.
Yeah. So you're like, screw you.
Your fucking friend gets a promotion when he doesn't deserve it.
Yeah. No.
Friend named Shmeka Shmambros. No, but this idealized self. It's so funny that when you do ask clients about who do you want, what are you really trying to become? A lot of times their idealized self is not even, they don't even want to be that. They just think they need to be that.
Yeah. And that's honestly been a question I've been asking a lot lately, which is, what is your perceived, and I always emphasize perceived best self and perceived worst self, because it gives you so much information. It's is that because I want to be that, or is that because I'm feeling triggered and I'm responding to some experience from childhood that makes me feel really bad when I say something that I wasn't supposed to? Because my parent yelled at me whenever I said something wrong. And now when I hear my teacher say it right, now I sweat and get nervous. And then the reaction to your physiological response then becomes a trigger, and you start to hate yourself for that,
That cascade effect.
Yeah.
And I kind of feel like whenever I talk to clients, it's I have to explicitly state the answer I'm looking for is not the intellectual, logical one. I want the reptile, irrational, fuck you, Jacob.
Yeah.
Because that's closer to truth. And it's and that's why the lying thing, closer to truth for me is not necessarily objective truth, but subjective truth, which is why art doesn't necessarily have to be a depiction of reality for it to feel true. Picasso clearly is not a depiction of reality, and yet it resonates with a lot of people because there's some truth that goes beyond the material world.
Oh yeah, no, I totally relate to that, because I'll say this all the time, but it's so many people come in through my doors and say, I don't want to bash my parents, or I feel when I was a kid this happened to me, I felt abandoned, but I know that's not true because my mom was working 10 hours a day. And it doesn't matter what you think about it. It matters how you felt right now. Don't let that get in the way of figuring out. And then it also sounds like it's important when it comes to just relationships. You want to just let that side of yourself out. Otherwise, your behavior is role modeling shame.
And and not to just jump to, but that should be our top podcast, not to just jump. but not to just jump to something else, but like the modeling thing, I think is such an it should be more important with therapists. Like the idea of like, I think the nonverbal ways in which we communicate judgment or lack of judgment about something is much more subtle but important with clients.
Yeah.
Like
yeah.
I don't think I really don't think it's important to completely live at like you're supposed to be some model person. But I do think modeling things like it's okay to feel how you feel. It's okay for there to be conflict. It's okay for me to be angry, like the authenticity part of it. I mean, especially because my background is in dialectical behavior therapy, which, if you don't know, was kind of created for people with borderline personality disorder, which is kind of the research I've done. But it's now used for everything. And one of the main components of training when you're a DBT therapist is you are supposed to be radically genuine. Like that is the phrase, radical genuineness. And part of it is because people with borderline personality disorder, and this is specifically what my research was on, it have a much better ability to identify authenticity or lack thereof,
Yeah.
Especially because, a BPD at its core it comes from attachment-related stressors, right? And so someone with and people with BPD tend to have anxious attachment, and some people have avoidant attachment, but predominantly anxious. And so when you have anxious attachment, you're constantly scanning other people's faces. Are they about to reject me? Are they judging me? Because someone with BPD tends to have a lot of shame, and when you have a lot of shame, you don't want any of the triggers for shame, like judgment or whatever, to occur. So you're constantly scanning your environment to make sure that's not happening.
Yeah, no, my mind went right through the same hoops yours did, I think. And I was thinking about, wow, this is so attachment rich,
Yeah.
And even the other type, which we didn't get into, fearful attachment, which is negative view of self, negative view of others. I could just see that totally lining up with that. When you're working with someone with fearful attachment, what else can you do when they're doing all these therapy interrupting behaviors? And by therapy interrupting behaviors, or I think there's a different DBT term for that, right? When you're trying to mess up the flow, or you're getting in the way of therapy.
Oh, therapy interfering.
Therapy interfering.
Yeah.
Yeah, thank you. Yeah, therapy interfering behaviors I think is so present with the fearfully attached population, because there's just so much stuff getting in the way of just human connection, because you felt both of the worst worlds of it. And so when you're the therapist, it's so helpful to use the other DBT term you use, which is
radical genuineness.
Radical genuineness, because then they feel the mirror neurons, and that does the work that they might not be able to access just yet at the early parts of therapy.
Yeah, I think that, and the truth is I think that's super important for people with BPD, but I also think that as a population, especially like our generation, and are you millennial? Yeah, right?
Yeah,
But for millennials and like
love
the young
Gen Zs.
The young fuck Gen Zs. No, I love my Gen Z clients.
Yeah, me too.
I like to dip all the way down to like 14, but just a sprinkle. But I think like from my experience, authenticity is so important with younger people, because we're kind of surrounded by inauthenticity constantly.
Yeah. I mean, just thinking about COVID, it's just been an age where there's been the most, censoring when it comes to who you are. You're putting something on media that shows your 1% self, and it's just, how do you deal with that when you go in person? There's just so much inauthenticity. And I'm not sure exactly what you meant by that, but my mind went to media, so many filters that we have to go through in terms of communication. And I think that's why we can be afraid of phones sometimes, because through text you get to edit, and then send your best possible piece of material.
And it's so open to interpretation too, right? Like I feel like, especially with attachment, and this is kind of like what I did my dissertation about, this idea of understanding the mental states of others. Our ability to understand the mental states of others is significantly impacted by how distressed we are in that moment. So if I come in to this thing super distressed and I see you're, preoccupied on your phone, I might misinterpret that to mean you're not really interested in doing this, when in reality, it's my own stuff getting in the way of being able to see you clearly.
Mm-hmm. Yep.
Which is really interesting when you think about it, because people who have a tendency to become emotionally dysregulated are going to misappraise other people's thoughts more frequently.
Yeah, it's a snowball. It's an awful snowball process, and it's so powerful. I think one of the biggest things that I'll tell people in therapy is never underestimate the power of expectation in your thoughts. It's just, you can really underestimate it really easy, and I think we all do. And I will always just say, just imagine a lemon in your mouth right now. Just imagine it all on your tongue. And, most people can start to feel like a little salivation or something like that. And your body physiologically in the moment will start to prepare for a lemon being in your mouth. So it's changing things in the physical world, your thoughts.
There's like a classic study for smiling where if you put a pencil in your mouth, this is based on the research of like Paul Ekman and Duchenne smiling and stuff like that.
Yeah.
But if you put a pencil in your mouth, that it significantly impacts your sense of happiness, just because, like we were talking about before, the inner and external world kind of interact with each other. You can come from internally and go externally, like feeling happy and then smiling, but you can also smile and feel, and it's not an equal power in each direction, but there is an impact in both ways.
Yeah. Behavior and thoughts.
Mm-hmm.
Just listen out. That was an awful smile.
You're supposed to like scrunch you're supposed to make crow's feet with your eyes. I mean, you look like you're taking a shit.
I'm awful with the crow's feet. Yeah.
You're supposed to like I mean, I feel more positive, but it's funny, like the way we appraise or misappraise someone's intentions is so impacted by how we're feeling.
Yep.
And it's the research suggests that we tend to jump to conclusions more when we're more distressed.
Interesting. Yeah.
We're less open.
I see. Yeah, I hadn't thought about that. That takes away the flexibility.
Like, like there's a famous Barbara Fredrickson did research on something called broaden and build, the broaden and build theory, which is like when you're experiencing, I'm probably butchering this, but when you're experiencing a more positive just like sense of well-being, you're more creative, you're more willing to take chances. And then on the flip side, when you're experiencing a lower sense of well-being, you're definitely not thinking creatively. You're going kind of to old patterns of thinking, conditioned responses, stuff like that. Yeah. It's a spiral up and a spiral down kind of experience.
Yeah, no, that makes perfect sense. I like to think about when there's clients dealing with things in their life that are probably because of their assumptions,
mm-hmm.
and they're so distressed that they can't see it, and they come in my office and they say, I don't know why my life just is screwed up. Why do I keep on having so much misfortune? It's like as soon as something good is close, something swoops in and takes it away, and I can't see it being my own behavior, and I can't see it being due to a lot of other people's behavior. And so I always use this example and this analogy to help them get some buy-in when it comes to understanding how your thoughts might still be impacting this. But I'll say, well, imagine you had 2 kids in a house. One kid was adopted, grew up without a lot of food, and another kid grew up just completely filled with food their whole life. And they go to bed, they're upstairs, and they know that they have to wait for breakfast to eat. They hear their parents running around downstairs, moving stuff around, clashing dishes. The kid that has lived there and has been fed for a long time knows that they're probably preparing breakfast. The other kid that's been adopted has the first thought, they're hiding the food. I knew it. And so I just keep going with that analogy. Morning comes. They walk into the room and the parents wake up the kids and they say, hey, time for breakfast. And then they pull out the covers and they see there's a ton of bags and bags of chips right next to the feet of the kid who was adopted, who had the scarcity mindset.
Mm-hmm.
And so the parents say, well, you stole the food. Now we got to restrict your food privileges for a day. That might be kind of extreme.
Or these parents. No, yeah. But I like that analogy for sure.
Yeah, it really just captures that, you might be indirectly impacting reality in a way and also impacting the thoughts of the people around you as well. And so when you have an expectation, there's a lot of studies that talk about teacher expectations and then also student expectations. And let's say you had a teacher that was in they had a teacher with there was a teacher they set up for an experiment where they told them that, okay, you got these gifted kids in this classroom, and then you have these problematic kids in this other classroom. And the teacher would go in thinking, okay, well, I got to, get these kids to do well. And they say, well, we want you to measure their outcomes. And they found that the kids who were considered gifted did a whole lot better than the kids who were considered, problematic, even though they were just a random sample of kids. And it just goes to show that the teacher, because of their expectations of the kids, changed everything.
It's a self-fulfilling prophecy. It's so funny, too, because in elementary school, I was not picked for, they called it Project Extra, but it was like the gifted kids. And because of that, I was like, fuck you. I'm getting a fucking PhD now.
A few moments later.
Wait, so we were talking about
Expectancy.
Yeah, you know what's funny? Not to jump around, but but I feel like every time I hear the word expectations, it just brings me back to the idea of social anxiety, because oftentimes, and honestly, you know what's crazy is I think from my own personal experience having it when I was a teen that it was more prevalent, but as a clinician, I don't see social anxiety at the threshold of diagnosis as much as I thought I would. It's not as frequent. It's not as frequent as like generalized anxiety or even like adjustment disorder or complex PTSD. I feel like it's a much more like niche disorder.
Yeah, it is. I feel that way too, yeah.
But it's weird. It just surprised me that it's not as common. But the thing about expectations with that is I feel like people with social anxiety, much more clearly than other disorders, have these expectations about the way things should go, about the way an experience should be experienced, and that often kind of psychs them out of engaging in the experience itself.
Oh, yeah.
Yeah. But that's just an aside. It's expectations always kind of condition me to think about social anxiety.
Yeah, I mean, it's so connected. I think about that a lot too, and it makes me think about our main topic. I think I'm going to claim this as our main topic, but shame. The expectation of reality. I wanted to even add in that shame can be sort of an expectation of the self that's a little self-absorbed. It's like this expectation that you need to meet something really high, and because you don't meet that, you're unlovable or unworthy, and then you start to engage in self-hate.
I do think that people sometimes might think of shame as someone who's kind of like retreated into themselves and kind of not interacting with their world. But oftentimes I think it comes out on the other end of it, which is this overcompensation of I have to be the best.
Yeah. Oh, 100%. It's that 100% wanting to be the best. And it's the way to beat that is how do you get out there and be your 100% worst?
It's so funny though. It's so funny though. We're like two dudes talking who have pursued and gotten PhDs talking about shame.
Yeah.
And it's like the biggest overcompensation in the fucking world.
I barely think about my accomplishments, and that's a problem, know, and that I think that's what got us here in this boat. We, for whatever reason you did, I don't want to just assume, but covering up feelings of shame with hard work and thinking, I got to do my homework to keep up with the crowd. I got to do my homework. Otherwise, I got to, not be considered worthy. And so the more I did that, the more I got to the point of like, I now need to keep this up. I told one good joke. Now I gotta tell 100 more.
It's true though. I mean, I feel like accomplishments are not really celebrated when you experience a lot of shame. They're just kind of like, again, expected, and you just move right past them. And part of the trickiness of accomplishments is you don't want to go to the other end and just blow yourself up like, oh, look at how great I am. But I think the thing about shame that really throws people off when you're experiencing it is you're just not sure about your experience. Like you might even be proud of your accomplishment, but you're not sure if you should be proud.
Yeah.
Like there's a lot of there's something between you and your experience that gets in the way of you just allowing it to happen. There's like a lot of doubt and shame.
Yeah, and I think it works. So I think that's the positive end. I think it works on the negative end too. Not positive as in good, but on the negative end of I need to perform perfectly because every time I experience shame, I go back home and I do my homework and get better. And so you see how good you can do. You see how good you can perform because of all the homework you've done. and then your average performance becomes far more worse.
Which is partly why people with shame tend to not take riskier chances at things, right?
Yeah,
Because you're constantly calculating unconsciously in your head, like, what is the probability this doesn't work out? And if the probability is high enough, I'm not going to do that. I'm going to avoid whatever that thing is. Like, for instance, just to get meta, even us doing this, right? It triggers a little bit of shame because if it's not good, or we don't feel like it, or we look stupid or whatever,
Yeah.
There's an assessment internally of like, is this worth it? But at the end of the day, as long as you can kind of interrupt the part of you that wants to be mean to yourself, which I tell my clients all the time, don't be mean to yourself. But the reality is it's a lot easier said than done. And often the line I tell clients is it's simple, but it's just not easy.
Yeah. Yeah, no, I can think about several times during this podcast where I was like, okay, no, you got to keep it up, or...
I was thinking about that about you as well.
Yeah. I was
I'm like, he's not carrying his fucking...
No, I was like, what if I just started stumbling on my words and then I say, yeah, you know too much or something like that. And I made a really strong... I really challenged myself before this to say, I want to go in there and hopefully my worst perceived self comes out. And I make a show of myself or whatever, and I don't usually say make a show of myself.
That's very Southern. Is that like a Southern phrase? Make a show?
I was working on a CBT worksheet, and they said that, and it just stuck for some reason. I was like, that sounds very like boomer.
No, but I think that the self-blame thing is directly intertwined with all of the stuff we're talking about, because when you have a lot of shame, right, you tend to blame yourself a lot.
Yeah.
And I think that a lot of self-blame actually just serves a functional purpose, and that is, if I can assess this as my problem, then I can solve it.
Oh, wow. Yeah, that gives you almost a little bit of hope.
Mm-hmm.
That makes, I've never thought about that.
Oh, really?
No. It gives you control.
It's an illusion of control.
Yeah.
Because you don't actually, I mean, if something is within your control, yes, you can change it. But if something is not within your control and you're blaming yourself, then you're just kind of deluding yourself to feel less anxious.
Yeah. And it keeps you wanting to self-evaluate, and you're thinking you can control things, but not all the time.
Not all the time, and often the self-blame and self-worth kind of go hand in hand. And I think people sometimes have difficulty. I personally think a lot of therapy is reimagining and reconsidering what is within your control and what is outside your control. Like when you're setting a boundary with someone, they can abide by it or not. That's not really within your control. What's within your control is expressing the boundary and then enacting consequences if that boundary is not really agreed upon.
Yeah, there's acceptance there.
And that's the other part about acceptance, which is I feel like it's very easy to accept a positive experience. Like, accept this ice cream cone. That's the title of this episode. Accept this ice cream cone and eat it with full openness. It's very easy to do something like that. It's very hard to accept an unpleasant experience, and our minds think we can control something that's unpleasant, and so we try to avoid it or reject it, when in reality, acceptance is sometimes recognizing that something's going to suck, and the hope you have about doing anything about it is a problem. There's grief that comes with acceptance. You can't truly accept something without feeling some grief about what you can't do with it.
Yeah, the stuck point is, first, if I failed or something negative happens, then I'm not good enough, or I failed and it's within my control.
Mm-hmm.
But the underlying stuck point is...
Like, use an example.
Okay, so someone gets rejected. They ask a girl out on a date, and they say, sorry, I'm not interested. And maybe it was something to do with them, maybe not. Maybe they were a jerk. Who knows? But let's say they weren't a jerk. Let's say this was a Vinny, a perfect guy.
The model of humanity.
The model of humanity gets rejected.
This generation's Carl Jung.
Yeah, that's right. Carl Jung with just a little bit of Freud to be a little controversial.
Just as a dash,
a sprinkle. And so this perfect guy named Vinny shows up, and this girl says, I'm not interested. And then you automatically have a thought of like, well, I must have just said the wrong thing on the first date. I was too much. I was too much of this and too much of that. And then the stuck point there is basically the stuck point being, what do you believe about the situation that determines the future? And your stuck point is, this didn't work out and it was because of me. Therefore, I need to do better. And then there's a deeper stuck point there, which is a deeper assumption, which is whether or not the date went good or not was 100% within my control. And grieving that reality doesn't really match that. It's also a stuck point because it's...
And my life is completely within my control.
Yeah.
Like, I mean, ultimately, that, even if you intellectually go, I know it's not totally within my control, your behaviors often say otherwise.
Mm-hmm.
You know, even the idea of, like, wincing when something is coming at you implies that you can escape from it. Like,
wow. Yeah.
Like it's so far rooted in our reptile brains that we can avoid pain, which inevitably just creates suffering.
Oh yeah. I think there's an opposite direction you can go with this, which might be for another talk, but narcissism.
Mm-hmm.
It's like the complete flip, where I see it as like two spectrums. With shame, you're looking at life and you think, okay, those are the elite. I need to get there. If I am not there, I need to do my homework. I need to get really, really good at it and fine-tune my skills. And usually that leads to a pattern in which you don't feel like your raw materials are good enough for a situation unless you do your homework. And then you have on the opposite side, which is the narcissist who says, my raw materials are good enough, and if people don't approve of it, then there's something really screwed up about the people around me.
Which, to just describe what you're saying, is the spectrum of complete accountability, almost an excessive amount of accountability where it's inappropriate, to an excessive amount of lacking accountability where it's inappropriate.
Oh, yeah. Yep. Living in bliss, not facing reality. And both are actually not true realities, you know?
And it's kind of, I feel like all these spectrums kind of exist on this like horseshoe-shaped spectrum where the two ends kind of meet each other. And I think the shared similarity between those two ends is both types of people exist more in narrative than they do in reality. You know, like whatever narrative they have about the situation, like for instance, if someone is excessively accountable and takes constant blame about stuff, they're going to create narratives that the everything happens because I did this and nothing, you know, everything was within my control. And then the other side of it is nothing is within, and you know, it might manifest in different ways based on the situation, but that's the core belief that kind of governs those behaviors.
Wow, that's beautiful.
You know what I tried to. I actually wrote it on my hand. Imagine if I'm just like, you know, a narcissism and a cat. It's like smudge.
Activate 0.3 the last 10 minutes. Yeah, I think would be curious. I'm curious, and I think people listening might be curious. What's a good intervention for shame? What do you do? And I think one that a lot of people can relate to is, what do I do with shame when, you know, I know in my head that it's okay and I want to be in the present moment, and yet I still feel the physiological symptoms. I still get up for my presentation and start sweating. I still go on dates and people still keep rejecting me. What do you do with the snowballing of thoughts, the physiological reactions, and being stuck?
I do like to reverse engineer from behaviors back. So it's like if you're avoiding, like for instance, someone with a lot of shame might buy their friends stuff often as a way to kind of compensate for not feeling like they're enough to just be around, right?
Yeah.
And so stopping that behavior is a shame exposure. And often I feel like shame exposure at its core is just allowing yourself to feel it. And so someone with a lot of shame is probably engaging in a lot of behaviors that are avoiding evoking the shame.
Yeah, okay. Diving into the shame.
Diving into the shame with the understanding that you can have a feeling, and that feeling is not tell a deeper truth about who you are. The thoughts don't really matter. It's the feelings that need to be felt. And same with guilt, right? Like you have to feel the feeling. If something is in you, it's in you. Over time, it will change if you change your relationship to it. If the shame becomes a reminder of your past rather than an indicator of who you are, you will have a different relationship with it and use it as kind of a compass of which direction to walk in. You know?
Yeah.
What about you?
I just want to take a moment to appreciate what you said. That's yeah, that's good.
I mean, just my personal experience, right? Like, a lot of the things I've done have been shame exposures. For instance, like even like public speaking, right? That's for someone with social anxiety. That's a fucking misery.
Yeah.
But it's also kind of that's just to like go on tangents. I think all shame is false. The idea that you are inherently lacking something is always false in everyone.
Yeah.
There's nothing wrong with whatever you are.
Yeah. You're inherently valuable because you exist.
But that's the thing, right? Like, in order to get to a place where it feels false, you paradoxically have to swim in the emotion.
Yeah. Yeah. You have to exist.
Mm-hmm.
You have to exist in the emotion, which is a part of yourself.
Mm-hmm.
My strategy is very similar, working backwards. How do we get you to a space where we first challenge? What's your perception of what is shameful? What is your perception of the thoughts that lead you to that stuck point of shame? How do you work backwards to the point where you have someone who is feeling like, I need to adapt to my society. I have ADHD and I can't fit in. And
Ooh, that's a good fucking topic. We're not going to get to it, but shame and ADHD is like
so connected.
Yeah.
I mean, think about it. The hyperfocus piece. It's like, you know how good you can do when you hyperfocus, and then there's some random moments where you're just inattention and you're like just changing the subject for no reason, or you're
what's wrong
just
with
lost.
me?
Yeah, what's wrong with me? Why
Yeah.
can't I? Yeah, no, it's so much good stuff there, but it's challenging the stuck point that, hey, there's something wrong with me, when there's something wrong with the world for judging you in the first place if they did. And maybe they're trying, the world is not exactly doing what you think it's doing. Maybe they're judging and trying to get you to a space that you might actually benefit from, or they perceive you would benefit from, and yet you think that. But the whole piece is, how do you get away from that automatic thought that there's something wrong with me? And I think that involves a lot of self-love and diving into things like you said.
And it's funny you say self-love, because what I was thinking was, I think a lot of people with shame have it because they've internalized something growing up from their external world that was communicated to them. Like, there's something wrong with you. It's maybe not, it's not said with such like explicit kind of horribleness, but
Yeah.
it's said in a way where you internalize it. And I think when someone does internalize that feeling like something's wrong with them, the next logical thing that happens is they start basing who they are off of the feedback of others.
Yeah.
And the self-love part is exactly the opposite. Like, where is my attention going when I'm feeling shame? It's going towards others. Where's my attention going in general when I want feedback about who I am? If it's going towards others, it is a significant likelihood that you have a low self-worth, that you have a lot of shame, because you don't have a connection with your internal sense of self.
Yeah, yeah. Your anchor's not in you. How do you determine what's going on inside of you? That goes all the way back to attachment.
Mm-hmm.
You're finding your anchor in this reaction from whether or not the mom will be present or not.
Mm-hmm. It's the mom. I mean, sometimes it's the dad. Sometimes it's a sibling. Like,
Yeah.
it depends on the situation, but it is like there usually is a primary person.
Yeah.
And a secondary person.
Oh, yeah, yeah. And I think it's interesting is trying to beat the cycle of shame, too, if you think about it generationally. And there's a lot of good parenting tips out there. One of them is identify your shark music. So the music that you hear when you think something's going wrong.
Mm-hmm.
And so if you
I've never heard that. That's awesome.
I heard that from some other therapists. I was like, oh, that's really good.
Steal everything.
Steal it.
That's what
You
I
gotta
say.
steal everything. We started with the alphabet. Here we are. Now we got language. But what's your shark music? And then when you have a kid that grows up and they start navigating the world and they start doing something that you think is going to bring on shark music that brought on for you, you're like, crap, they can't get into rock music. They're going to be seen as an outcast. I was seen as an outcast. And then you yell at them in their natural urge to listen to rock music, and then they think, well, now I have this natural thing about me that's just not good.
Mm-hmm.
It blows my mind how much that connects with me, because I was just yesterday actually talking to my wife Tilbe about, what about when we have kids? And I said something that was just so benign, but just brought like tears to my eyes, and she didn't even catch it. So I did the awkward thing where I brought it back to me. I was like, oh yeah, I kind of teared up when we said that.
What'd you say?
She said, what if our kids don't like fried chicken? And I said, that kid's going to have to pick whatever it wants, you know? It's going to have to live his own life. And so that moment I was like, I'm just coaching to myself, you know? Like,
you're being what you wanted, you know, for yourself. And I feel like all the time, a lot of, especially millennials, are like, I'm afraid of being a bad parent or whatever. And it's like, the very act of saying that, I mean, I don't want to say this because it's not true, but it's kind of true. The very act of saying that almost prevents that from happening. You're reflecting, you know?
Yeah.
As long as you're capable of reflecting, you're capable of growth. And as long as you're capable of reflecting, you're capable of holding yourself accountable.
Yeah. Holding yourself accountable is huge, because if you don't get that messes everything up.
Wait, what's the fried chicken thing? Do you guys eat fried chicken? I never see you eating fried chicken.
I love fried chicken.
I love fried chicken.
We should get fried chicken.
Where?
There's, what's the name of the place? La Jolla UTC Mall. There's a chicken place.
Really?
Yeah, it's like a ramen place. It's like anime background.
Is that the wings place that you were talking about?
No, that's Banchan.
I still want to try
We
that.
should do Banchan.
I still want to
We
try.
gotta go get food, guys.
I ran out of bread at home, so I was just like eating Costco croissants
My gosh.
every day. It's really bad. It's like
Best life.
one thing that I don't have in my apartment, and I become like a awful. My health just declines immediately.
Yeah,
I'm eating like fucking microwavable burgers from Trader Joe's. My wife's like, I'm like, I'm health. It's cheap. It's
Saving money. No, you need some chicken. We need some chicken in our life.
But like I feel like shame too. And this is the other part about like working with a predominantly gay caseload is, I think personally our superpower is when you have shame, you can relate to people who are brought up in a environment where their sexuality is not the expectation. At least it hasn't been in the past. And anyone's first instinct would be like, why am I different than this other person? Yeah. Why am I attracted to this? And everyone seems to be not attracted to this.
Yeah. Oh, and I think about this topic a lot when you think about religious trauma.
Mm-hmm.
What happens when your natural urges can be something that gets you to hell?
Mm-hmm.
And how do you deal with that? There's a whole lot of experiences that out here where clients are talking about that. And it's like, I think there's a unique kind of shame when a longing that you have that pops up very frequently is either constantly denied internally or constantly denied externally. And so it's like, where do you go with that when your natural urges can take you to a place that is just the epitome of judgment?
That's the worst part about the mistaken belief that my emotions are an inconvenience or whatever. Like, not only are my emotions an inconvenience, but also the thing that seems to guide me towards happiness is a problem.
Yeah.
Like, you're fucked if that is your internal compass. Because you have to, I mean, why do I like watching basketball instead of soccer? Why do I like eating, In-N-Out instead of Burger King? Well, because In-N-Out's much better. But you have to allow, and I often use like restaurant and food analogies because we never negotiate with, like, we go to a bad restaurant and we go, oh, maybe my taste buds, maybe my taste buds are incorrect.
Mm-hmm.
We never invalidate things like that in our perception.
No.
But the second it's like, oh, I'm interested in taking ballet, but I'm a straight man. Like, something interrupts that.
Yeah, I'm not on the normal bell curve, so something's wrong with me.
Mm-hmm.
Or a normal bell curve, just the norm. And
Yeah.
I think that's a really good topic because that's something that I feel like people be interested in when it comes to faith,
Mm-hmm.
religion, your sexuality,
Mm-hmm.
and working with clients that are LGBTQ and that pop. I think that'll require a lot of time though.
Yeah, for sure. I mean, I like to say sometimes after sessions, I'm like, "Are you healed?" And the answer is always no.
Yeah, the thing that I hate the most is when I'm like, okay, how are you feeling? And so my mind is like, I want to know how you felt when we asked this question. I want to know what your perception of this question was. And then they're like, well, I'm still on the path of health. And I think I feel maybe a little bit better after today. It was nice to get some stuff off my chest. And I'm just like, I wasn't curious. Like I didn't want to
They're, like,
imply
giving
that
you
I
something.
killed you. I don't want them to unintentionally think that I'm making the joke that you're making very overtly, which is
when a client goes into emotionally accommodating the therapist mode,
oh yeah,
it's like, shut it down.
Yeah.
Shut the fuck up. Stop.
Yeah, stop it.
I had a therapist that I really liked when I was in grad school, and he said something to me about what someone told him about being a good therapist is, which is essentially your clients, not every session, but for the most part, should be leaving the session feeling better and not knowing why. It's the clients who leave and go, I feel better because of this, this, and this. And we talk, and it's like there's an intellectual gap between like what you experienced and how you actually felt it. But it's the ones that kind of go, I don't know, but sometimes, most of the time, I just feel lighter when I leave here. I think that is a bigger marker of change. And also, like, the therapeutic delay, I call it the therapeutic delay, which is like you're doing work with someone, and at some point after a couple of months, you really start to see progress. I feel like in session, and this is more, I guess, to like other therapists, but I feel like in session, the markers of progress feel so huge to me, but on the external, they're more like a client says, I told someone I didn't want to hang out. But to me, and I think in reality, but to them it feels small, but to me it's like, this is huge for you.
Oh yeah. That's a huge reaction I'll have. It's like, this is huge. Like,
Yeah.
You literally broke a pattern, and I think maybe it's almost like that thing where when you study something for so long, you can see the intricate changes. But I feel the exact same way when a client tells me, I told someone that I didn't want to hang out, or I decided to do a little self-care today.
What's funny, though, is when a client just breezes past it or doesn't want to acknowledge it, and I go, like, you have to, in those moments, like, pat yourself on the back.
Yeah.
It's important for you to do that. And they go, well, it doesn't feel natural. And it's like, why would it feel natural?
Right.
Why is the assumption that you being nice to yourself feels natural? Why do you think you're here?
Exactly.
Because being nice to yourself is unnatural, and the way, and this is the other thing, I feel like people mysticize, I don't know what that word is, but people make our minds so much more complicated than they are. We are mostly a product of conditioning. And so if you're conditioned to ignore positive things and accentuate negative things, what do you think it's going to feel like to say something nice to yourself at first?
Yeah, it's like a workout.
Mm-hmm.
The only time we praise people to work towards failure is working out.
Yeah.
And we miss that when it comes to therapy. Not to say that you want to overdo it to where you get injured, but you want to feel a little uncomfortable. If you're not feeling that uncomfortable in therapy, then maybe you might need to tweak some stuff.
I often tell clients, like my idea of the direction we're supposed to go is generally just like, what do you not want to do? That's what we're going to do.
Yeah. You don't want to do mindfulness? We're going to do some deep breathing for the first 10 minutes.
I was explaining like exposure to my wife, like back in grad school. And I was like, yeah, it's like this thing where if you push someone into like putting themselves in an environment where they're uncomfortable, eventually they get more comfortable with it. And she's like, it sounds like you're just describing torture.
Yeah.
I'm like, it kind of is. Yeah.
It is kind of funny. Sometimes I'm like, it's just no duh. We're trying to get people to cry in therapy.
Yeah.
And some people, and then when I take a step back, like the other person's like, you're supposed to do therapy to get happy. You know, it's like,
I tell people when they're crying that we charge by the tissue.
oh.
A few moments later.
All right. Well, we covered a lot of material today.
Mm-hmm.
And this is the point in therapy where we give our one-liners on, hey, it's time to, talk about what we want to do for the week, or...
What are you fucking talking about? Well, you're really fucking this up. We're going to have to cut that.
Shame scratch.
I really enjoy... I mean, let's just say, I really enjoyed this, and I really like talking about therapy on top of doing it, obviously.
Yeah.
I feel like you do, too.
I do. I love this. A couple of things about me. Enneagram 4, 5-wing. I think people who don't like the Enneagram are weird, but not really. It's okay. And I also like to understand things and talk about them. And so I'll have these conversations all day in my head.
Me too.
So this is really nice. I feel like you entered into my, psyche a little bit, and we've both shared a whole bunch, and I really enjoyed it.
Yeah, me too. Let's definitely do this again.
Yeah. Next time, tune back in. We'll be back.